Hello everyone, I'm Professor Lee of Dr. Herbal Medicine TV. Although this is known as food, in fact, it's a medicinal plant of the lily family with a long history. And among the superfoods reported to be effective in treating metabolic syndrome, in addition to diabetes, it's the food ingredient with the largest number of clinical papers. It is garlic. The main active ingredients are organosulfur compounds such as allicin, allin, diaryl sulfide, disulfide, and trisulfide. In addition, saponins, polysaccharide, and polyphenol. Black garlic is made by heat-treating garlic to increase the amount of polyphenols. Let me tell you why diabetes improve if you eat garlic regularly. 1. Stimulate insulin secretion from pancreatic cells. After taking garlic, blood sugar levels decrease within 1 to 2 weeks. This effect reduces blood sugar more rapidly than other medicinal plants. 2. It increases insulin sensitivity and maintains a continuous decrease in blood sugar levels. 3. It reduces insulin resistance and restores pancreatic function through antioxidant and anti-inflammatory effects. 4. Because it inhibits enzymes that break down carbohydrate consumed in large quantities, the rate and amount at which glucose is absorbed into the body decrease. 5. Increase micro blood flow and protect nerves. It improves complications of diabetes. Hey, garlic is really amazing, isn't it? Although the pharmacological mechanism of diabetes treatment is clear, the anti-diabetic effect must be proven in actual clinical studies. The total of 33 papers and 1,273 patients been studied so far. The daily doses for garlic powder 300 mg to 1,500 mg divided into 2 to 3 doses. Aged garlic extract 600 mg to 2,400 mg. For garlic oil capsules 300 mg to 900 mg taken 2 to 3 times. For crushed raw garlic, 100 mg per 1 kg of body weight divided into 2 to 3 doses. The duration of use is at least 4 weeks. Let's looking at the blood sugar reduction rate. Fasting blood sugar level decreased by 10.9 and HbA1c level was 0.6. This level of reduction is a very strong anti-diabetic effect. Targeting 91 patients with diabetes complications in 2022 research, after taking 500 mg of garlic extract twice a day for 4 weeks, intraocular pressure and macular edema decreased and visual acuity increased. Now I'll tell you how to take garlic. 1. Because it's effective, there are many capsules and tablets. Simply search the internet, purchase the product, and take it according to the recommended dosage. 2. For garlic powder tea, mix 300 mg to 1.5 gram of powder in 250 cc of boiling water. Drink it like tea after 10 to 15 minutes. 3. Dried garlic decoction tea, 5 to 10 gram of dried garlic slices per day in 500 cc of mineral water. After boiling for about 15 minutes, drink it like tea. 4. Tea is good, but garlic is a food, so it will be good to use it as a food. Just take 2 to 3 pieces a day consistently. Crushed raw garlic, cooked garlic, aged garlic, and black garlic are all good. Side effects and how to deal with them. You need to be aware of this because you'll not eat it occasionally, but you'll eat it consistently. There have been no side effect reported in many clinical studies, and it is generally safe. However, if you take too much or are sensitive to garlic, you may experience side effects. 1. Gastrointestinal problems. If you experience temporary heartburn, digestive problems, nausea or diarrhea, stop for 2 to 3 days, and then start again with a small amount. 2. If allergy symptoms occur, stop and visit a hospital. 3. Because it has an anti-diabetic effect, symptoms of hypoglycemia may occur. If you experience dizziness, cold sweat, or loss of consciousness, it can be immediately. 4. If you are taking diabetes medications, anticoagulant, or antiplatelet drugs, consult your doctor. 5. In case of overdose, the smell of garlic on the breath or body may persist for several to 24 hours. Garlic is not only good for diabetes. To date, superfoods have been reported to be effective in improving metabolic syndrome. Garlic, flaxseed, blueberry, cranberry, cacao, ginger, spirulina, gooseberry, chili pepper, strawberries, chia seed, quinoa, maca, and wheatgrass. Among these, the number of clinical research papers reporting effectiveness, number 1 is garlic. It seems like a real loss if you don't eat garlic. If any of you have diabetes but you dislike garlic or not suitable for you, then you look at the Dr. Abraham Manson TV playlist. Please take a look at the lecture video on the top 10 medicinal plants in the world that are effective in improving diabetes. Next week, let's learn about the number 1 herb with the powerful diabetes improving effects. Stay healthy everyone until we see you again.